Diabetes is a medical condition affecting how your body uses sugar. Sugar, or glucose, is a vital source of energy for the cells that make up your muscles and tissues. It's also your brain's main source of fuel. When you eat, your body breaks down carbohydrates into glucose, which then enters your bloodstream. Sugar is in many foods we eat, such as fruits, vegetables, dairy products, and grains. Even foods that don't taste sweet, like bread and pasta, can raise your blood sugar levels. It gives our bodies energy. This energy is essential for everything we do, from breathing to running a marathon. Without enough glucose, your body wouldn't be able to function properly. A hormone called insulin helps sugar get from your blood into your cells. Insulin is produced by the pancreas, a gland located behind your stomach. When you eat, your pancreas releases insulin into your bloodstream. Think of insulin as a key. It unlocks the doors to your cells, letting sugar in. Once inside, the sugar can be used for energy or stored for future use. It unlocks the doors to your cells, letting sugar in. This process is crucial for maintaining balanced blood sugar levels. In diabetes, this process doesn't work right. There are two main types of diabetes, type 1 and type 2. In type 1 diabetes, the body doesn't produce insulin at all. In type 2 diabetes, the body either doesn't produce enough insulin or the cells become resistant to insulin. Sometimes your body doesn't make enough insulin. This is often the case in type 1 diabetes, where the immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Other times your body can't use insulin well. This is common in type 2 diabetes, where the cells in your muscles, fat, and liver become resistant to insulin. This means sugar builds up in your blood. Over time, high blood sugar levels can lead to serious health issues such as heart disease, vision loss, and kidney disease. High blood sugar can cause many health problems over time. It can damage your blood vessels and nerves, leading to complications like neuropathy, retinopathy, and cardiovascular disease. But with the right care, people with diabetes can live full and healthy lives. Managing diabetes involves monitoring blood sugar levels, eating a balanced diet, exercising regularly, and taking medications if needed. With proper management, individuals with diabetes can lead active, fulfilling lives and reduce the risk of complications. Our bodies need sugar for energy. Sugar in the form of glucose is the primary fuel for our cells. Without it, our bodies wouldn't function properly. When you eat, your digestive system breaks down food into sugar, or glucose. Glucose enters your bloodstream, where it travels to cells throughout your body. This process is essential for maintaining energy levels and supporting bodily functions. Your pancreas, an organ near your stomach, makes insulin. Insulin is a hormone that plays a crucial role in managing blood sugar levels. Without insulin, glucose would remain in the bloodstream, unable to enter cells. Insulin acts like a key, allowing glucose to enter your cells for energy. Think of it as a gatekeeper, ensuring that glucose can pass through cell membranes and be used for energy production. Imagine a bus, insulin transporting passengers' glucose to their destination cells. This transportation system is vital for keeping our cells energized and functioning properly. In diabetes, either there aren't enough buses or the passengers can't get off at their stops. This means that glucose can't enter the cells, leading to high levels of sugar in the blood. This results in high blood sugar, which can damage blood vessels and organs over time. Chronic high blood sugar can lead to serious health issues, including heart disease, kidney failure, and nerve damage. Managing blood sugar levels is crucial for overall health and well-being. High blood sugar can cause several symptoms. You might feel very thirsty or urinate more often. Some people lose weight without trying. Blurry vision is another common sign. You might also feel very tired or have slow healing sores. If you experience any of these symptoms, it's important to see a doctor. Remember, not everyone with diabetes has symptoms. That's why regular checkups are important, especially if you have risk factors like a family history of diabetes. Section 4. Types of diabetes. There are different types of diabetes. Each type has its own causes, symptoms, and treatments. Understanding these differences is crucial for effective management and care. Type 1 diabetes usually develops in childhood or adolescence. It is often diagnosed in young people, but it can appear at any age. The body's immune system mistakenly attacks cells in the pancreas that make insulin. This autoimmune reaction destroys the insulin-producing beta cells, leading to a lack of insulin. People with type 1 diabetes need to take insulin every day to survive. Insulin therapy helps to regulate blood sugar levels and is essential for their health and well-being. Type 2 diabetes is more common. It accounts for the majority of diabetes cases worldwide and is often linked to lifestyle factors. It usually develops in adulthood. However, with rising obesity rates, it is increasingly being diagnosed in younger populations as well. In type 2 diabetes, the body becomes resistant to insulin or doesn't make enough. This leads to elevated blood sugar levels, which can cause various health complications if not managed properly. Gestational diabetes develops during pregnancy. It occurs when the body cannot produce enough insulin to meet the increased needs during pregnancy. It usually goes away after the baby is born, but can increase the risk of developing type 2 diabetes later. Women who have had gestational diabetes need to monitor their health closely to prevent future complications. Regardless of the type, managing diabetes involves a combination of medication, healthy eating, and regular physical activity. Education and support are key to living well with diabetes. Working with a healthcare team can help individuals with diabetes create a personalized management plan. Regular checkups and monitoring are essential to prevent complications and maintain a good quality of life. Section 5. Managing diabetes, diet and exercise. Managing diabetes involves keeping blood sugar levels stable. A healthy diet and regular exercise are crucial for both type 1 and type 2 diabetes. A registered dietitian can help you create a meal plan that fits your needs. Choose foods low in saturated and trans fats. Focus on fruits, vegetables, whole grains, and lean protein. Regular physical activity helps your body use insulin better. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Section 6. Managing diabetes, medication and monitoring. People with type 1 diabetes need to take insulin injections or use an insulin pump. This delivers insulin directly into the bloodstream. People with type 2 diabetes may take oral medications or injectable medications that help the body use insulin better or lower blood sugar. Regular blood sugar monitoring is essential for all types of diabetes. This involves pricking your finger to get a drop of blood and using a glucometer to measure your blood sugar level. Section 7. Living well with diabetes. Diabetes is a manageable condition. By following your doctor's recommendations and making healthy choices, you can live a full and active life. Manage stress, get enough sleep, and have regular checkups with your healthcare team. Remember, you are not alone. There are many resources available to support you. Connect with a diabetes educator, join a support group, or reach out to loved ones for encouragement. Living with diabetes requires effort, but the rewards of good health and well-being are worth it.